I mentioned earlier, Juja Member of Parliament Francis Waititu recently made the headlines when he announced that among hundreds of Kenyans seeking cancer treatment in Indian hospitals, 13 members of Parliament in Kenya, 9 of whom are members of the National Assembly, while 4 are Kenyan senators. He of course made these remarks after returning home from successful treatment of brain cancer in India. To put all this into perspective, while medical tourism is an option for Kenyans who can afford to travel abroad for specialized treatment, what happens to the patients who cannot? That's what we want to talk about in studio today. Joining me in studio, I'll start from the far right there. We have Dr. Elijah Matolo, Head of Provider Partnership, Jubilee Insurance. Welcome to the program. Thank you. Next to him is Dr. Louis Mashogu, President, Pharmaceutical Society of Kenya. Welcome to the program as well.
Asante sana.
And right here next to me is Honorable Francis Waititu, Member of Parliament for Juja. Welcome to the program as well.
Thank you very much.
Mheshimiwa, let me start with you.
Yeah.
Before going to India, you were first treated in Kenya.
Yes.
And I'll ask that as you share your story, please don't mention the hospitals. They are not here to defend themselves.
Yes.
Kindly share your experience here and then what led you to India and, of course, the experience there as well.
Thank you very much. Of course, what led me to even go for a test of cancer is my now older sister. But she was in class 4, which is not easy to treat. Mm-hmm. Then after that, my mom was talking about headache and what, but later on, she went to the test, and luckily, she was in stage 1, but now she's fine.
The mom?
Yeah.
Also,
but
so those are 2 family members already.
But after elections, I also thought of going to a hospital, although you've said I don't mention the name, where now they confused my cancer to different things.
Did you have symptoms? What were you feeling that made
No symptoms, but I'm looking at my mother and my sister, and I said, because of that elections, let me go and be checked.
Okay.
And that is why I'm happy for me to be here to advise our people. Checking of cancer in stage 1 and 2. Okay. You can be given any dawas and you are okay. But when it goes to 3rd class, in the middle, then that is where the problem comes. Okay. But now when I went, when I went about mine, I was not sleepless according to the doctors the way they asked, but it's not a national hospital, but a big hospital in our country. They gave me the wrong diagnosis. And I started taking down medicines for malaria, I don't know for what, for TB. But later on, one doctor told me you must get now a scanning of your brain and we see what is happening. And I got that. That is now when I was told that you have brain cancer. So I stopped all the other drugs, and he told me you must be operated so that, and this is where I want Kenyans to understand, so that there is a block of whether it's the brain, whether it's the chest or anywhere that you have cancer, the block now comes. There is a block of you operated and then that piece of block is removed. So that is now it talks about you. But now when I got that one, I was advised, we don't have those machines in our country. We only have 2 in India and 15 in America.
2 in India and 15 in America?
Only.
Around the world?
Around the world.
My goodness.
So that is why now I'm here today to ask our government, the county governments and national governments, our former 8 provinces, even if it's the 9 billion that now tells you where is your cancer, at least let's go back to our 8 provinces, but the Rift Valley is a bit bigger, now we go to 10. So the national government and county governments, instead of building 26, 30, 40 billion at the governor's offices and what, let's go to cancer. But what I want to tell my people in this country, cancer is like malaria or any other disease. Once you go and you are diagnosed very early, and you go and take any dawa, then you're fine.
What was your experience like in India?
My experience in India was that now we have 9 million Kenyans there.
Now, right now?
Right now. And I was
how did you count 9 million?
Because I was made the chairman. Luckily, I was done operation here. So when I went there, radiotherapy and chemotherapy that I was going through, there is no day I was removed in the machine through a wheelchair.
Okay.
Or told to go to my room, to the hospital for a day, so that I regain my strength. That is why even I met the Prime Minister.
Of India?
That is God. It's not me.
Okay.
And we talked about it. And I met
and you spoke about, first of all, you spoke about our leaders who are going there for treatment. You met with leaders.
I don't mention.
You don't mention
names.
names, yes.
But now there are members of parliament there and senators, and one is almost now coming by flight when he's not there because
he was in a bad state.
Bad state. But cancer, even you tomorrow, go for a checkup. When you go for any checkup of cancer, and you are in stage 1 or 2. Any dawahs that you are given, you are fine with it. But when it goes to the middle of class 3, then that is yours alone.
Are you ashamed, Mheshimiwa, as a lawmaker, that you had to go to India to get the kind of treatment that you required?
Because now in India, those are the only machines. Do we have them here in Kenya? Recently, when I came back, I went to Kenyatta National Hospital. Because once somebody is supposed to be done radiotherapy, means 5 days in a week. Monday to Friday, you must go. But here in Kenya, when a patient goes, anaambiwa machine imeharibika. So that means you are not done every day. So cancer takes you far. Right now in our country, what we do is go for Harambes. We get about 2-3 million. We send somebody in India. But the people who go to India sleep outside because the hotels are also a bit
expensive.
So 5,000 people are sleeping outside,
waiting for radiotherapy, waiting to see a doctor or whatever it is.
Yeah, and that is now why now I tried to fight that out even when I was in India because I was going to see them. I also got a chance to talk to the senior people in India, but thank God, I know you know Mangu High School where it is. Somebody has given us land.
50 acres.
26. Yeah, no, yesterday he ongezed.
Oh, so it's more than that. Okay.
So that India now brings that hospital here.
Fair enough. Let me come back to you, Mheshimiwa, and let me get reactions from my other two guests here. Dr. Machogu, let me start with you. And even as you respond to what he has to say, we know that, is it about a year or two ago, the Kenya Network of Cancer Organization, through their chairman, said that 75% of cancer patients seeking treatment in India can be treated in Kenya for less money. Or there was talk of a cartel, quote unquote, that sends patients to India. Let me get your thoughts on that, even as you respond to what Mheshimiwa has said.
Yeah, so, I mean, asante sana. For this, in Kenya, our citizens go to India looking for maybe 3 things. The healthcare itself, technology, so like Mheshimiwa is saying, equipment to be able to diagnose, the biopsy, you know, things like that. They also go for the drugs. Yeah, because remember, in India, they manufacture 99% of their pharmaceuticals. What they consume, they manufacture locally. Yeah, so, and also, like I said, technology and the product, and just because, again, they have volumes, because remember, if you want to make healthcare affordable, then you have to have volumes. It's a numbers game, yeah? So in India, luckily, they have a lot of population. Yeah, and of course our country, Kenyans are moving, Africans actually, the biggest driver of medical tourism in India is Africa. And like the chairperson said there, we can actually do it in Kenya because we have volume. The volume comes from Africa as well. Yeah, we have
it's easier to travel to Kenya than to go to India.
Exactly. So we have, if you go back, the healthcare workers, we have them. Yeah, we have we have local manufacturers for pharmaceuticals. Yeah, we have the pharmaceuticals, we have the technology. Yeah, the machines that Mheshimiwa is saying, we just need to ensure we have the right equipment operators and equipment in KNH, and maybe, like he's saying, 8 referral centers in the country, and we'll be able to do it. So what we are seeing as a flight also is also, you can't really say a cartel, but it's also the patient. You know, you weigh and see, do I want, like Mheshimiwa said earlier, I was mishandled
in Kenya.
You know, when you hear that, do you want to try again as a citizen? But just to touch on that issue of mishandling.
And we've seen something yesterday. I don't know if you watched the story, Kenyatta National Hospital as well. Another lady saying that they did my cesarean in the wrong. And in fact, I watched that story as I was planning for this interview, and I thought to myself, my goodness,
what is happening?
What is going on here?
Yeah. So I think let me answer that question. What is going on? What is going on? So we are having a situation where in our country, we first at the healthcare level. There's this thing is called task shifting and task sharing. So we have the only people who work in these facilities are nurses. They do everything. So the nurse dispenses medicine and gives medical care, gives an injection, does the diagnosis and what have you, maps it with a medication, because we say we don't want to hire the right people at the right level of care, so that we have a team. What we're having is we're having a healthcare system that is burdening the nurse, and a doctor goes and diagnoses someone with cancer, for example, but there's no team. In Kenya we have oncology pharmacists. These are pharmacists. In India you'll find them. There are many. In KNH I think we only have like 2. We need like 10. So these oncology pharmacists, what they do is, once Mheshimiwa was diagnosed with that cancer, he was given a that is okay, map with the medicine, give a name to the condition, give a medicine, and there are many medicines. So get a team. So the oncology pharmacist comes in. So what Mheshimiwa was done for, he was left alone with medicine and the prescriber. And the prescriber again is so loaded with many patients, so he has no time to follow up. But now the oncology pharmacist is there waiting for you to come, and we form a team together with your healthcare worker, your prescriber, so that now we can manage together with the nursing care, so that we now help. We can actually see within 10 days and say, Mheshimiwa here is not going well with this medicine. This is not his medication. Can we get something else? I'm
not waiting for Mheshimiwa to say, I'm not feeling
so
good.
Now, yes. So we are saying we're having a system that is letting the patient be by themselves. They don't have an advocate.
Yes.
So we are looking for a team.
Mheshimiwa is clapping. And I wish people were seeing that shot.
And that teamwork is what will make our Kenyans be detected early and managed before they progress to the next stage.
Fair enough. Let me bring in Dr. Matolo, Elijah Matolo. I want to get your thoughts as someone from the insurance sector about how the insurance sector views Kenyans asking to go to India versus asking to be treated here. What is the standard? I mean, you cannot speak on all insurance providers, but I'm sure you have the thoughts of where is the insurance sector in terms of, do we need to send Kenyans to India? Can we do it here? Let me get your thoughts on that, even as you react to what both guests here have said.
Thanks a lot for the opportunity. So insurance, and specifically private insurers in Kenya, have had so many requests coming in from our insured members to go for treatment in India. And some of the things that give us that comfort when you're sending patients there is, number one, and this is based on the feedback that we get.
And it's important for us to understand why your thinking is on the same. Go ahead.
Yeah, so number one, the hospitals in India have understood how the health system needs to work. Number one is they have a multidisciplinary approach. When you're looking sometimes locally, just getting the services of one person, it's an oncologist, but how do they work hand in hand with the other members of that team? Be it the pharmacist, there's a counselor, there's a nutritionist, so that you're giving wholesome care. So when we look at the other thing about cost, anytime we are sending any of our members to India for treatment, you actually get a very good indication of what the cost is meant to be. Unfortunately, within Kenya, the hospitals have not reached that level yet, where you can say, for this procedure, this is the estimated cost. And, it comes after doing a lot of research, looking at all the cases that you've handled maybe in the last couple of years, and you're saying that you're sure that this one will cost you this much. For purposes of planning, number one, predictability. So if anyone is going there, they know that this is the amount of money they are probably going to spend, and they have budgeted and prepared themselves initially. So when you look at the aspect of quality, so when you look at the people going to India, so some of them are going because of cost. Somehow they've been able to make sure that some of these services are cost.
My younger brother here.
Okay.
131, I'll give you the clips here. 131 countries are the people who go to India. 55 million. I'll give you that when you leave. So what do you closely saying is true. Sorry about that.
Yeah. So the aspect about cost, you know, when we are looking at improving our own health system locally, you know, talk about strengthening our health systems, we need to borrow a lot of what the hospitals in India have done. And number one is that multidisciplinary approach. The other thing is having that predictability of the prices.
Okay.
The next thing then is when you come to the issue about pharmaceuticals. Pharmaceuticals contribute up to more than a third of what you pay out in healthcare. Yeah, so for us in Jubilee Insurance, that figure is usually above 2 billion every year. And you know, we're paying just slightly around 6 billion. So more than a third of that just goes to pharmacy. So what has India done? India, number one, has advocated for universal use of generic drugs. Yeah, and when you look at the difference in cost between the generic and the branded drugs, and we see it, you know, when you look at the invoices of the members who we send to India, all of them are being given generic. So the question is, why does our local health system
I was about to ask you that same
not
question.
appreciate
branded drugs only?
Yeah, so it's one of the things that we've been advocating a lot, you know, as ways of reducing the cost of healthcare. If a third of everything you're paying is pharmaceutical, then that's the first place you need to look at.
Yes.
So advocate for more use of generics, and that is what India is doing. It's actually, at some point, the Prime Minister, Narendra Modi, made it, you know, they were proposing to have it mandatory that all doctors prescribe generic drugs.
Really? As part of the law?
Yeah, as part of the law.
It's actually in our Health Act that we are moving towards prescribing by generic. So what that means is, let the doctor give you the best medicine, and a scientific name, the generic name. So that the person at the pharmacy there, the pharmacist, you go there as a patient and you say, I am able to, this is my budget.
Budget, yes.
So that we see, the pharmacist now takes a responsibility. Whatever medicine they are giving you is the right one. Because what happens when you keep prescribing in brand names, you're actually perpetuating what is called counterfeits. Because now the counterfeiters just know Nizi dawa tatu they'll be prescribed.
Yes.
So it's easier for them to, but to describe by generic name, no one can predict.
That makes a lot of sense.
Yeah.
Mheshimiwa, since you made that revelation, what sort of reaction have you gotten from leaders, from ordinary Kenyans?
Of course, very good. Even in Parliament, 90% yesterday supported me, and even the President himself, because they know what we have really spoken about. What we need to do is now agree, county governments and national government, on health and agriculture. We will have to work closely.
Give us solutions.
Remember, there is even machines that the President bought and they refused to take. That is not where we want to go. Because health and agriculture is what can make this country move. Because once you are sick, you can't eat. When there is food and you are sick, you can't. Those two is what I'm asking Kenyans to do. But now, there is something I wanted to inform you about the third now stage of cancer. That now becomes you only. That is why I was telling you now, when you go to India, that is where you'll know, because there's no other machines anywhere else. But now, what we are trying to ask as Kenyans, because now Professor Anyang' Nyong'o has agreed I have cancer. Beth Mogo, the senator, has agreed I have cancer. Now I'm also in Parliament saying the same thing. Why don't we now team up? Because, you know, the first stage and second stage, you can take any dawas and you're fine.
And you can deal with it here.
And it's not painful. So you can have cancer for so many years, but it's not painful. When it's almost class 3.5, 4, that is when now you start feeling.
Do you support the proposal by President Uhuru Kenyatta of the decision to bring in Cuban doctors?
Of course. You know, now even in India, when you go to India, we found the doctors who are, you know, they have seen a lot of problems, so they are well, you know, experiences also. When he brings them, it is not that we are employing them. Yeah, they are coming now to teach us on what to do, and they are gone. But if we can even employ them for 2 years or so, then we get,
skill.
And then we take now our doctors. It's not bad. Experience is better than cure, you know that.
Mheshimiwa, what happens to your constituent watching this show who has stage 3 cancer? He's watching you, and I suspect he's very envious.
I can't now lie, but now in my constituency, Juja constituency, since I said that about cancer, one of my neighbors was in my house yesterday, a lady I haven't seen in the church for some time. And why are people hiding cancer?
Yeah.
Cancer is just like malaria or anything early detected. So that is why I am happy you called me today to tell Kenyans, no matter whether you are in Kisumu, Kakamega, you are in Northeastern, go and do a checkup. And after 6 months, you do a checkup. Once it's realized, you are given dawa and na unapona. Don't wait. That is why I'm happy you called me today. But now, what now? Even the
what's the long-term plan? Because I'm trying to think of that person in Turkana.
Yeah.
Can they get the sort of screening facilities?
You told me not to mention names, but there's one Turkana person who yesterday told me the same. And I told you even now, those who are also suffering from cancer in parliament today now have their names. And the senators are sending their names. Cancer is just like any other disease. Mungu asaidie tushikane pamoja.
My question though is, it appears that it is only in Nairobi that you can get a certain quality of screening. What happens to that pastoralist who is wondering, why am I feeling pain
That
there?
is why my brother...
Can they afford to travel all the way to Nairobi to get that? That's how
That is why now, my brother, I'm here. Asking the Kenya government to work closely with the county governments so that the 47 counties and now the national government come closer.
Okay.
If we can have 8 or 10 in the old provinces.
To cover each region.
To cover each region. That will help us. Because this thing is not painful.
Yeah.
Until it gets to the third stage.
Yeah.
Exactly.
Dr. Mushoku?
And just to support what Mheshimiwa is saying, in Kenya we have a policy document called Human Resource for Standards and Norms for Human Resource for Universal Healthcare Coverage. It's a document we made, Ministry of Health made this document together with stakeholders in 2014. So what this document says, we have certain services at different levels. There are actually 3 levels. Level 2, 3, we have the dispensary and health centers, even in private sector equivalent ones. We have level 4 and 5. That's the hospitals, the district hospital, and any private facility that claims to offer that service, and a referral. So what we are saying is that pastoralists, they must have a dispensary near them or a health center. If you have a proper team there, pharmaceutical technologies.
That's a big if.
Yeah, and that's you know, you asked about what are the solutions. What we are saying is Ministry of Health to implement its own document in both county facilities and national facilities, and even private sector as well, so that anyone who claims to have a level 2 and 3 hospital, whether public or private, should have the requisite professionals. That is how you will be able to be detected early. Because someone will just say, these symptoms look like this. Please, can I consult with my colleague here? You know, right now you just find only one cadre of staff. Can I consult with my colleague? And quickly they say, actually, this is something that needs to be referred. When it's referred here, the team here again says, you know, that's efficiently using our resources. But what happens now, the pastoralist, siku moja ataanguka, ajipate KNH, never had to pass through the chain, the system. And actually, even by this level 2 now, what you're calling level 4 and 5, they would have actually been managed, as Mheshimiwa is saying here, because we have teams that are able to give you oncology medicine and manage you at that level, so that now we can now start focusing, and we need to move to a place where we have oncology centers as referral centers, specific. Yeah, because we have, exactly, like now you're talking about the Cuban doctors coming. I personally, I'll put a disclaimer, I personally support the Cuban doctors coming, because what it will do, it will expose the things us as healthcare workers we've been saying all along. We've been saying that.
Because when you send a Cuban doctor to a county that doesn't have facilities,
they'll say,
they will not be afraid
to speak out. They will say that the referral system is not working, because there's no pharmacy personnel, there's no clinical personnel. How come I'm treating something that could be treated at that level? Because you're bringing a specialist. A specialist should come in, so you take them to that referral center, maybe in that county. They will quickly smoke out the issue we have been smoking out all along.
You've been complaining about all along.
So that's what we are saying. So the referral system, that's one. And the other one is we need to insist to the public, whenever if you are diagnosed with cancer or anything, seek a second opinion. But don't go seeking by yourself with like just a layman kind of thing. Go get your family pharmacist. Yeah, talk with your physician. You know, like now you are
someone who's aware of your medical history.
Exactly, so that you guys can work something out.
Fair enough.
And again, our brothers. And again, our brothers. We know there is health, Ministry of Health.
Yeah.
let's try it now, because we are almost changing the constitution after 10 years. Let agriculture and health be in the national government.
Are you sure we're almost changing the constitution?
Yeah, 10 years. After 10 years, we are there.
It's going to happen.
Only 2 years.
Although we did not call you today to
Those are politics.
I want to let our viewers know that you can share your thoughts on this topic. The state of healthcare in Kenya, the push by Kenyans who can afford to go to India to do so as well. And when Mheshimiwa found there, he was shocked by the number of Kenyans he found there seeking medical treatment, including our leaders. And of course, that raises the question of, if our leaders have to go to India to get treatment, what does that say about the state of healthcare in this country? But more importantly, the state of trust in the healthcare system. That's what I want to come to you, Dr. Matolo, and get your thoughts on. Do you get Kenyans coming to you saying, I don't want to be treated here if they can afford to? Mimi, you know, please take me to India or to South Africa or somewhere else. And what does that tell you as an insurer? Does it tell you that Kenyans are losing faith in the healthcare system? Well, what are your thoughts on that? I'm sure you do surveys and all sorts of things.
So I wouldn't say that people are losing trust. People just want to get the best out of the best outcome.
Okay.
So if you feel that you're going to get the best outcomes in a different country, then that's what you're going to do. So if you can't afford, then that's what you're going to push for. The thing is, when you're looking at even how to strengthen our health system locally, there are very key lessons that we can learn from other countries. And when you're talking about Cuba, the thing is very simple. We are trying to do what Cuba has done. So, it doesn't mean we go and get the Cuban doctors. We go and see what is it about the Cuban healthcare system that we can bring and implement within the country. So, Mheshimiwa has talked about, how important it is for you to actually have early detection of cancer. So, there also has to be a lot of education happening in the country. The thing is, when you talk about cancer, cancer is not one disease. Cancer is a group of so many different kinds of diseases.
And it's not just cancer that people are going to treat in India. We actually showed some stats that, if I'm able to pull out some of that data, I have some of it here. In terms of percentages from Jan to March last year, before I allow you to continue, cancer patients were 57.8% from Kenya, went to India. Renal patients were 16.8%. Cardiovascular disease, 7.8%. And skeletal disorders, 3.4%. So there's a lot of reasons why. Okay, so there we have those on the screen. Sorry, go ahead.
Yeah, so by the time you find many people going for treatment for cancer, that means there's been a failure from the primary healthcare and the secondary. So we have failed to do prevention. And when you talk about prevention, each of the different kinds of cancers has specific things that you can do. When you're talking about breast cancer, doctors will tell you that, you must do, a monthly self-breast examination. If you're below the age of 35 or 40, you must have at least an annual ultrasound of the breast. Or, if you're above that, then having a mammogram. If it's prostate cancer, there are tests that can be done.
Brain cancer. Mine was brain cancer.
So there are tests that he needed to do before.
That's the thing. There are cancers that are easily detectable.
Okay.
Some of them, unfortunately, you can only catch them when it's late because the symptoms are not very specific.
Fair enough. You'll allow me to interrupt you because we need to take a quick piece of breaking news. I'll come back to you to get your closing comments on this particular discussion. Let's take you now to Nyeri County, where Kieni Member of Parliament Kanini Kega has condemned the motion seeking to remove Health CS Cecily Kariuki from office. Let's listen in.
The motion to impeach the health minister's CS Cecily Kariuki. It's very annoying because one, the minister has been in office barely 3 months. So you cannot even accuse her of incompetence. The kind of flimsy grounds that have been adduced, one, saying that she did not appoint a particular individual to be the CEO of KEMSA. We know very, very clearly the process of appointing any officer. The board does their recruitment. Then the minister is given 3 names. The recruitment in KEMSA was done in July last year. Minister Kariuki was not the minister for health that time. Why didn't the minister that time not appoint the purported person who is supposed to have taken that seat? In any case, there is no way the minister would have appointed a person who was recruited and not appointed from July. Those are about 7 or 8 months, you know. So there is more that meets the eye in these whole shenanigans. Secondly, the former CEO of KEMSA, Dr. Monyu, was from my constituency. If there is any person who could be complaining or who should be complaining about KEMSA, it should be me and my team from Nyeri. But we cannot stoop that low. We know there is a separation of power. We know who is supposed to do the recruitment of CEOs of different institutions. So when you give a reason that you want to impeach a minister basically because the minister is following the law, we are not going to take it lying down. Secondly, we have this allegation that the minister told the CEO of Kenyatta National Hospital to proceed on compulsory leave. It is actually not the minister who did that. It is the board of Kenyatta National Hospital which did that. The minister only pronounced what the board said. And you cannot crucify the minister for following the directive of the board. In any case, this thing has now taken a tribal or regional issue, which should not be the case. I have given an example.
All right, I think that message there by Honorable Kanini Kega could not have been more relevant to what we are discussing, because we're in a situation where we're talking about how to move Kenya forward in terms of healthcare, but the CS at this moment is under a serious fight between members of parliament, and a lot has happened, and all this politics and confusion makes one wonder whether the ministry has even time to focus on some of the recommendations that we're talking about, or it's constant firefighting. Let me give each of you a chance to give me your last thoughts on this particular discussion, which where you said I need to give you a chance to repeat a message that you came very clearly with. Yeah, I can give you a chance to do so now.
My message is to my fellow Kenyans, because we are one country and one people. And because cancer, people have been fearing to say that I have gone to a hospital and I am now a cancer patient. Please, let's be open. Because of the food that we eat or climate changes that we get cancer from, in Kenya now, almost 40% are people who have cancer but they don't know. So to go early checkups is what I came to ask them and ask God to lead them. Because once you are checked early, you'll be treated here in Kenya. But when it becomes a bit complicated, that is why you see, not only Kenya, I told you we have 131 countries, 55 million on that one hospital, Apollos. I didn't check the other ones.
And there are many others there.
There are others. And now we want to ask the county government and our national government, apart from any other, because health comes first, let's come together on health, counties and national government, and have some machines that are not here at all.
In your own small way.
Even that one that is in Kenyatta is the lowest.
In your own small way,
yeah.
Between now and when that hospital will be constructed, or between now and when the governors will come together, what are you going to do to improve healthcare for the people?
Me, I'm going around the country.
Okay.
Yeah, because mine was brain cancer, and it's one of the serious cancers, you know. But God has helped me. I want to go around the whole country. We want to meet with the president. We want to meet with the governors and some senators, and we get a team that goes around. Because cancer has killed so many people in this country, and even now, so many are suffering. So we ask God to help us so that we come together. And on health, there's nothing else God can bless us about more than the cancer.
Okay.
Yeah.
Okay. Dr. Mashoko, let me get your thoughts on this. I know you want to respond to what he had to say, but I'm thinking there's so much happening in the healthcare sector right now.
Exactly.
If it's not about focus on Kenyatta National Hospital and the probe, if it's not about Cuban doctors, if it's not about the fight we are seeing at Afya House, in terms of small steps to take this discussion forward, what do you think Kenya needs to be looking at? So even as we're dealing with all these other things, what needs to be our focus in the short term, in 2018, for example, 2019? What would you say if you were consulted on that?
So for me, it's I'd speak to both parliamentarians and government, and tell them this: healthcare is very expensive to deliver. It needs focus. It needs 10 years to give you a return.
Oh, so we can't even talk about 1 year.
No. So so first to paint that picture, but there's some things you can do in 1 year. What His Excellency went to Cuba and he saw a working community referral system.
I'm told they had a white coats brigade. They came up with a name for the way they, I don't know, Cuba somehow would export doctors to other countries.
No, imagine, so that's what we are saying. So what His Excellency and CS Kariuki, which we are sure she'll pass through this motion, and we are calling on Speaker not to allow for this impeachment motion, and we say, let's focus. She has come in, give her time. Let's focus on working on a community health referral system, that ensures that we have the right people on the ground. Next, I'll speak to His Excellency. He needs to leave a legacy around healthcare.
Can he do it in 4 years if you're saying he needs 10 years?
Of course
he can do it in 4 years. This is how he'll do it in 4 years. Let me give you the figures, for example.
You're sitting next to a politician, so be careful you don't get roped in. Go ahead.
Yeah, so he can actually do it. And the thing is, we have professionals. We have unemployed health workers in this country. And these workers are saying, you know what, we are here to support you. And we're here to support you by just... All we need to do is just work on the community referral system. Put us in the right places so that we can diagnose and use the medicine, the little medicine we have, the right way. So that, right now what is happening is we are mismanaging patients because we don't have the right teams on the ground. Talking to the patient, can you insist, when you're being diagnosed with diabetes, hypertension, and all those things, if you are left by yourself without being assigned a pharmacist and a medical officer and a counselor, then you are getting shortchanged. You should have at least those 3 people to help you walk that journey.
I want to interrupt you because there's something interesting you've said, that the unemployed health workers only want to see a structure for them to fit into it. But we also hear that there are many who've refused to go work up country.
Okay.
Either the pay is not commensurate. I've been brought up in Nairobi. I've studied in Nairobi. You're sending me to the border. I don't know what to expect there as well. So some are saying, let the Cuban doctors come. They are willing to go to that area where our Kenyan doctors are not as willing to. How would you respond?
So what we are saying is I represent 400 pharmacists who are unemployed.
As we speak.
I represent a number of we have the whole sector, the pharma sector, we have almost 13,000 pharmaceutical staff. And what we are finding, the numbers of unemployment are in the region of 2,000. This pharmaceutical staff. You're saying, put these people in those areas. They are willing to. I myself worked in Mararal, that's in Samburu district, for 3 years. That was my first posting. I went there. And that's how I got my experience and actually came and said, you know what, our healthcare system needs community systems that work. So speaking to His Excellency, and if you're having a struggle to get workers to go to those places, come talk to us as professional associations. We have the staff, our members. Simple. It's as simple as that, and we allocate them to those places so they can do what they're meant to do.
Okay, let me bring in Dr. Matolo into this. There are those who feel that insurance companies benefit from a broken down healthcare system because they can charge whatever they want to charge and people will pay because they don't want to go to public hospitals. What would you say, or how would you defend insurance companies in that they are helping to drive healthcare forward and to provide solutions? How would you respond to?
So the Kenyan health insurance market has been plagued by so many different challenges. Number one, we seem to be insuring the same group of people. That is employed. The people who are employed have very few people in informal sector who actually have a private medical insurance. As we are at the moment, 90% of all the people who have a private insurance cover are getting it through their employers. So we cannot say the current system in healthcare is working to our advantage. On the contrary, if we want to increase access to healthcare, number one, we have to make sure that we have access to health financing mechanisms. So number one, the biggest financier, of course, is the government. And we are very happy that, the current government is prioritizing NHIF as a key driver to implement that increased coverage of healthcare.
And I want to let our viewers know we had invited NHIF to join us on Citizen Extra both on Tuesday and Thursday, and they have not shown up even today. Go ahead.
Yeah, so now from the private insurance perspective, we want to get more people. But how the average insurance product is priced is a factor of the cost of healthcare. So if cost of healthcare is high, the premiums will also be high.
And your profit is in there as well somewhere.
Of course, you know, if it's a private insurance company...
I'm asking on behalf of Kenyans.
Yeah, there has to be a margin, you know, same as any other private business. All private businesses, the key aim is also to make profit. But there is that purpose, that impact we have in the society. Out of the almost 250,000 people that we cover, we make sure that they get access to healthcare when they need it, and it's access to quality healthcare. But the biggest challenge we are getting, and organizations come to us and they're wondering, why do our premiums keep on increasing? And it's a simple thing. You know, if the cost of healthcare continues increasing, then the cost of insurance will also continue.
So you can
increasing.
confirm that the cost of healthcare has been increasing over the years?
It has been increasing. I think it's, you know...
You have some stats or anything that you can...
So medical inflation is, you know, it's been about between 10 to 15% year on year for the last so many years. So that means the premiums that you're paying will continue increasing with almost a commensurate amount.
Okay.
The challenge is insurance will try and see if it can absorb that amount, because our customers tend to be very price sensitive. You increase the premiums, some of them drop off, others may decide to move to the NHIF, others will stop insuring altogether. So for us, you know, reduction of the cost of healthcare is a key agenda to also help us to be available and also increase access to some of the services that we are offering.
Fair enough. Thanks so much, Dr. Matolo, for that, and for my guests for finding time to be here with us. Let me just read 3 quick SMSs. Someone says, Isaac Langat from Embakasi, we want to contribute for the machines as Kenyans. It's for our own benefit. So someone is joining you, Mheshimiwa, on that.
Thank you very much.
Another person says, and unfortunately we are out of time, please address the topic about our very own Kenyan diaspora who are very well trained and will not return home. How do we interest them? And finally, Erastus from Turukana, that's how you say, you start, you say, I agree with the MP about strengthening the county health system and in terms of provinces. Is the machine for screening cancer more expensive than some of the aeroplanes that we are buying or that the government is helping Kenya Airways to buy? Let's look at priorities, right? Thank you for the information. I think we're going to have this topic on another day and take a look at some of these other issues as well.